3 things you should never do that increase your risk of getting bowel cancer, colorectal cancer. You'll hardly ever hear me say the word never, but in this case, it's really never, because you can't afford to make these mistakes. I'll also tell you about the 7 warning signs and symptoms of bowel cancer and how you can protect yourself. What is the best way to prevent colorectal cancer? What are the risk factors? Who are the risk groups that should be most cautious? So everything about this type of cancer. And what are the 7 warning signs and symptoms of bowel cancer? First one is changes in bowel movements, either more frequent diarrhea or less frequent constipation. Your usual pattern matters a lot here. You used to go every day, now it's 3 times a day, or you're going once every 4 days now. There's a change in pattern which can't be justified by, say, a viral infection. You've got an infection, so yes, it's probably going to increase how often you go to the bathroom. But you didn't have any change in your diet, you didn't start eating more or less fiber, you didn't start exercising, you didn't have any change in your routine that justifies it. You don't have any virus and you didn't start taking any medication that can cause diarrhea, for example, or constipation. You had an alteration in intestinal transit. This can be a sign of bowel cancer and should be investigated further. And this alteration in intestinal transit, it persists for more than 3 weeks, and it can often oscillate. 1 minute you have diarrhea, then you get constipated, then you go back to diarrhea again. It can be that type too. It's not always going to be just diarrhea or just constipation. Number 2, belly pain, abdominal pain. Most people describe this pain as a cramp or pain when having a bowel movement, which can also be a warning sign for bowel cancer. It's very important to pay attention to these signs, these warning symptoms, because if detected early, the chances of recovery are much higher than if the disease is discovered at a later stage. And colorectal cancer, bowel cancer, is among the top 3 deadliest cancers in the world, so pay very close attention. Number 3, bloody stools. There's a significant difference within this warning sign. If it's a region closer to the end of the intestine, the blood will be fresh. You'll see the blood in the stool. But if it's in a distant region, this bleeding can appear as a change in color, darker stools, often even black and foul-smelling stools. Why? As a more remote portion, it allows the intestine itself time to digest this blood. So you don't necessarily need to see the blood, but a change in color, a darker color. Sure, there are other things that can also cause a change in stool color, like eating beets. In this case, it is when there isn't an underlying cause, right? And I wanted to highlight that bleeding in the stool, most of the time, is not going to be cancer. Hemorrhoids are a much more prevalent cause of bleeding in the stool, but you should certainly investigate, as it may be a warning sign. Number 4, exhaustion, fatigue. You can often have anemia, more specifically a type of anemia called iron deficiency anemia, due to iron deficiency because of the bleeding and also because there may be an alteration in the absorption of certain nutrients and also an increased consumption by the tumor. So exhaustion, fatigue is one of the most common symptoms of colorectal cancer, colon cancer, by these mechanisms that I've explained. Number 5, bloating in the belly, abdominal bloating, because depending on the location, cancer can obstruct and alter intestinal transit. This can cause bloating, a change even in the digestion of food. So that's another red flag. Number 6, weight loss. Weight reduction is also one of the hallmark symptoms of bowel cancer. Why? Cancer can produce substances that generate nausea, a lack of appetite. You may feel less hungry. This can cause weight loss. Another reason for weight loss could be cancer consuming and increasing your energy output, which leads to weight loss, lower food absorption, which can cause diarrhea, as I explained in the first symptom. So, weight loss. Here I will say a 10% reduction in weight is a warning sign. It counts, because I talked about changes in bowel movements. Remember, it's a weight loss that can't be explained by a diet. You didn't start doing more exercise. You're not normally restricting your calories. you're not careful about your diet, but your weight still dropped, this is indeed a warning sign of bowel cancer. It's important to emphasize it's not always all or nothing. You don't have to have all these symptoms to be alert for bowel cancer. Often there will be 2 symptoms, sometimes 3, so that's really variable, isn't it? And for number 7, you have this feeling that you haven't fully evacuated, known as tenesmus. You go to the bathroom and feel that there's still stool left. You may have this sensation due to the tumor. Another change is the change in the stool shape. Ribbon-shaped stool. It becomes smaller, actually thinner, okay? So feeling like you didn't evacuate everything can also be a sign of bowel cancer. And how to protect yourself? What are the risk factors? Bowel cancer is closely related to our habits. So, reducing fiber intake increases the chance of having bowel cancer. So, to protect yourself, what are you going to do? You're going to increase the intake of fiber, fruits, vegetables. You're going to add the fibers that I often talk about here on the channel, for instance, chia and flaxseed, in a simple way. You don't need to completely change your diet. You add chia, for instance, to a fruit, to a salad, and you can significantly increase the amount of fibers and reduce the chance of you having this type of cancer. I emphasize chia and flaxseed here because it's a practical and easy way to do it. I know it's hard for those of you who work away from home or live in a remote region to schedule 6 or 7 meals with fiber. It's very tricky, but in this way, you can considerably increase your fiber intake in a very easy and practical manner. Another significant risk factor is obesity. So weight control also helps you diminish your risk of bowel cancer. It's vital to remember that there are lifestyle changes, like starting to do physical exercise, having a more natural diet, without processed and ultra-processed foods, without foods that contain preservatives like nitrates and nitrites, like in the case of salami, cured pork shoulder, turkey breast, and salamito. If you avoid these foods, you'll also protect yourself. So, a more natural diet with weight control and physical exercise. I'm talking habits here. The healthiest lifestyle protects against bowel cancer. But I know there's someone who did all this and still got it. These measures help you reduce the risk as much as possible. But there are genetic changes that increase the predisposition to this type of cancer, no matter how many healthy habits someone follows. But that's no excuse not to do it all, okay? Smoking's also a risk factor, so quit. I won't dwell on it, you know already. Alcohol consumption, especially excessive, is linked to increased risk of bowel cancer. How are you going to protect yourself? The American Society recommends that you start screening with a test called colonoscopy starting at 45 years old. If you have any risk factors, like an inflammatory bowel disease such as Crohn's disease or ulcerative colitis, that could be done earlier, or if you have a first-degree relative or know that you have a genetic predisposition in your family that increases the risk of bowel cancer. For example, if you have a sibling who had bowel cancer at age 44, you would start having colonoscopies at 34, 10 years earlier than your relative had this cancer. But generally, start screening at 45. Why is it so important that you get a colonoscopy? Because during this exam, besides early-stage diagnosis, which greatly increases your chance of healing, if you have a change in the polyp that will become cancer, you can remove it during the exam. Look at how many benefits there are for your health. In other words, a colonoscopy can prevent some cancers from developing, which is extremely beneficial. And what are the 3 mistakes you can never make? Before I tell you the mistakes, if you've made it this far and you enjoyed the video, then don't forget to like it. Let's set a goal of 20,000 likes, a little higher than the previous videos, because that way the system understands that the content is relevant and will disseminate it to more people. As you have already seen, this video can save many lives. And the first mistake you can never make, something I talk to patients about, and every week I hear someone say it and make this mistake, is not wanting to have a colonoscopy because you think it's a dangerous exam or that it's a bad exam. That involves preparation, and you will have to dedicate some time to prepare before the exam, that you're going to have diarrhea and have to take pills to clean your bowels. But know that cancer is much more dangerous and is much worse than preparation or screening. So that's no excuse. If you haven't done a colonoscopy and your doctor recommended it if you're old enough for this exam, don't make the mistake of thinking it's dangerous or that the preparation is bad, because it's worth it and it's a very beneficial exam. As I said, it might even prevent bowel cancer. The second and very common mistake is to do the fecal occult blood test and not think that a colonoscopy is necessary. But I don't have any bleeding, so I don't have cancer. That's a big mistake. If you take this from the video, I'll be very satisfied. The fecal occult blood test is not a screening substitute for a colonoscopy. It can be complementary, but it cannot replace a colonoscopy. So if you're only doing the fecal occult blood test and you're feeling calm because the test came back negative, you should know that there are several types of cancer that do not bleed. Also, oftentimes when you do the test, sometimes the cancer is bleeding, but at that moment it's not bleeding, so the test will come back negative. It's not a substitute for a colonoscopy. Don't fall for that, okay? Not only can it give a false result, it gives you a false sense of peace of mind. And the third mistake you can never make is with the blood test, referred to as CEA or carcinoembryonic antigen. This test is also not used to detect bowel cancer. It's not used as a screening tool. It's become very popular. Several people tell me this in my office. I want to do the blood test to see if I have cancer, bowel cancer. Many come saying the name of the test, but this test isn't validated for screening. Why? There are many types of bowel cancer that don't produce CEA, so it's not very reliable, and there are also other situations that aren't cancer. These are benign diseases that increase the carcinoembryonic antigen. This can be confusing and lead to an unnecessary investigation. So the CEA blood test doesn't serve as screening. It's not good for that. It doesn't substitute a colonoscopy either. But why does this test exist? That's a question many people ask. This test is used for follow-up after you've already been diagnosed with bowel cancer. So it does have some use, but it isn't for screening. Did you like this video? From 0 to 10, what grade would you give? If it's 10, I'll make more videos like this. Also, comment from which part of the world, from which city you're watching this video. I'm speaking from Porto Alegre. Now I'll leave a recommendation for a video to watch, one that I talked about the 12 benefits of fiber consumption, more specifically chia seeds. You already know one of the benefits, which is for the intestines, but there are another 11 that you don't know. Do you want to know? Then in this video you'll find out all about chia seeds. I'm sure you'll like it. Take care.